Hi, good evening, friends. Today I wanted to talk about a very interesting phenomenon that has been found in Japan and China, Korea, and some of these countries where they drive their workers really hard and expect them to work long hours and very little vacation. The name of the illness is called Takotsubo disease, and Kareshi is the other name for the same illness when it becomes lethal. So, what is this phenomenon? So basically, what you have is often these young professionals that are driven by their multinational companies to work long hours. It's not uncommon to find such individuals working 80 or more hours, maybe 100 hours a week, not a month. And basically staying late in the evening. And then on top of it, sometimes they're trying to promote their business after hours by going and drinking with customers and just driving themselves into the ground, burning the candle at both ends, so to say. So what happens is that suddenly, because of a setback in this high stress state, maybe they had a disagreement or an argument with their spouse, or perhaps the prospect of a loss of a job, a poor evaluation, and they become overwhelmed. And it flows down from their mind, their soul. Well, soul is not a medically technical term, but you know what I mean. When they're mentally anguished, it affects their physiology. A lot of catecholamines are released. And the stress seems to sensitize the myocytes, the cardiac muscle cells. And in the left ventricle, the tip of it, they become dysfunctional, the myocytes, the muscle cells. And what you have is a failure, a heart failure. The heart dilates and it becomes like a pot. Normally the left ventricle is has a narrow space, normal space. But in the case of Takotsubo or broken heart syndrome, that's the other name for this, broken heart syndrome, the ventricle becomes dilated and dysfunctional. It's not able to pump out the blood that is required. So the person may go into heart failure, shortness of breath, and they may have chest pains. There's even some conjecture. Although this is not totally, it's not been validated by, I think, objective studies. They have anecdotal studies in stressed out animals that the myocytes begin to degenerate, or they've had a few cases where the human being also at autopsy showed some kind of a degenerative process going on in their myocytes. So anyway, they become dysfunctional. They're not contracting properly, and the ventricle may actually balloon. The net result is heart failure, angina, perhaps angina-like pain, because I think the high adrenaline state also affects the high catecholamine states also affect the microvasculature of the heart. So you can have people that end up with a heart attack or a stroke or just heart failure, and there's a sense of pending doom. And obviously if your heart's failing, you're going to feel that doom. But it's the emotional anguish that I had mentioned, that doom, along with the physical sensations of failing physically, that brings them to the ER. And so the nomenclature or the classification and the way we think about it has evolved somewhat. It's no longer like just emotional stress or psychosocial stress. It's also any physical stress, acute asthma attack, or acute bout of an illness of any kind, like pneumonia or an infection. That can also precipitate Takotsubo Syndrome, or the broken heart syndrome. Treatment is bed rest, reassurance, and they can provide ACE inhibitors. They may help. Beta blockers may help with the congestive heart failure. What you want to avoid is ionotropic, like stimulant kind of catecholamines, wherever possible. So once you treat this, you have to modify their lifestyle. And the Japanese government has recognized that this is a problem. Karoshi was the other extreme end of this, where young executives were falling dead in their offices because they had these long hours and they had all these data and statistics about their company, and surrounded by all this data sheets, they were found dead on their computer consoles. So it's a very sad phenomenon. The same kind of thing occurs in China also. They have a different name for it. The overworked death syndrome. They have the same kind of syndrome in South Korea, where it's really bad. In China, it's surprising because they have pretty strict labor law, being a socialist country and all. But they have managed, the multinational companies have managed to circumvent those laws so that they are driving their workers into the ground. So the key thing is to recognize this thing and to put an end to it before it gets bad, before it victimizes your workers. Give them a break, give them the Friday afternoon off if they've done well. Don't do the 996 schedule, which is like these companies, multinationals, are wanting people to work from 9 a.m. to 9 p.m. 6 days a week, and no paid overtime, and they want them to be grateful for it. So don't do that, okay? Don't drive people into the ground, and you'll still thrive, you'll succeed if you keep your workers alive. And a balance of work and your normal daily life is what should be strived for, and what these companies and these workers should aim for. Anyway, that's a little bit about the broken heart syndrome, Takotsubo disease, or Kareshi, the sudden death due to overwork. Takotsubo is the illness due to overwork. Anyhow, take care and have a good day. Some scenery of September 10th, 2020. So there's a halo around the sun at sunset, and there's just a gray mist from the